Hello everyone, Assalamu alaikum. Welcome back to my channel. So today we have an important topic, respiratory failure. So let's get started. First thing first, what respiratory failure actually is. Simply, respiratory failure occurs when your lungs can't provide the enough oxygen to the blood or can't remove the carbon dioxide efficiently, or sometimes both. So today we are discussing the type 1 respiratory failure and type 2 respiratory failure. Each of these has its own unique characteristics. So let's differentiate both. Type 1 respiratory failures are also known as hypoxemic type, and type 2 respiratory failures are also known as ventilatory type. Type 1 respiratory failures are pink puffers, whereas type 2 respiratory failures are blue bloaters. Type 1 respiratory failures are thin and hyperinflated, whereas type 2 respiratory failures have strong build and wheezy. So now let's discuss the causes of both the types. So the causes of type 1 respiratory failures are pneumonia, pulmonary embolism, pulmonary edema, fibrosing alveolitis, whereas the causes of respiratory type 2 failures are COPD, asthma, cerebrovascular disorder, myasthenia gravis, and motor neuron disorder. Now let's compare the criteria for type 1 and type 2 respiratory failure. So for the type 1 respiratory failure, PaO2 is less than 60 mmHg or less than 8 kilopascal, and PaCO2 is less than 50 mmHg or less than 6.7 kilopascal, which means PaO2 is decreased and PaCO2 is normal to decrease. Whereas in type 2 respiratory failure, PaO2 is less than 60 mmHg or less than 8 kilopascal, and PaCO2 is more than 50 mmHg or more than 6.7 kilopascal, which means in type 2 respiratory failure, PaO2 is decreased but PaCO2 is increased. Differences is very crucial for the management part, as type 1 respiratory failures requires the strategies to improve the oxygenation, like the oxygen replacement therapy, whereas on the other hand, type 2 respiratory failures usually requires a strategy to improve the ventilation and remove the excess CO2. So it often requires non-invasive ventilation. I hope this helped. If you found this video helpful, don't forget to like, share and subscribe to my channel for more such content. See you in the next video. Until then, bye.